Good afternoon, everybody, and welcome to our webinar on understanding behavior therapies for your child and trying to find the right fit. I'm Dr. Nancy Carnevale, one of the developmental pediatricians here at Anna Shaw, and I'm accompanied today by my colleagues, Kelsey Cameron, board certified behavior analyst, and Lee Turner, licensed professional counselor. So you may have heard somebody say to you, your child needs behavior therapy. Maybe it's your pediatrician says your child needs behavior therapy, or a teacher, or maybe another family member, or even just feeling that way yourself, that you know your child has issues with behavior and there's some type of therapy that should be done. But it's really confusing. What does that mean? Who do you call? Where do you start? What does it look like? And that's what we're going to try to address today. There are multiple types of behavioral therapies, and finding the right one for your child depends on a number of things. It depends on your child's symptoms, their unique needs, your family goals, and often just their specific diagnosis. So just a little definition about behavior therapy. Behavior therapy is a broad term that we use for evidence-based approaches that focus on changing behaviors using structured interventions. There, it's based on the principles of learning and reinforcement, helping develop positive behaviors and trying to reduce or eliminate the problem behaviors. Behavior therapy is commonly used to treat just many things. We use it for autism spectrum disorder, and that's going to be our ABA, which we'll talk about a little bit later. We use it for attention deficit disorder. We use it for disruptive disorders, such as kids who are getting in trouble for aggressive behaviors. And then we also have specific therapies for children that have anxiety and depression. Therapies can involve working with the child, working with the parents, and most of the time it's actually a combination of both. So we're going to address kind of the three major behavior therapies that we do in young children. The first is called Parent Behavior Management Training, PMT. Unfortunately, there are multiple names and multiple acronyms, so it can get confusing. But if it has parent and behavior and training in there, it's an overall parenting program. There's a specific type called parent-child interaction therapy, which we'll talk about. That's a common one, PCIT. You may have heard of that. Then we're going to talk about cognitive behavior therapy, which often addresses things like anxiety and depression. And we're going to talk about ABA. And just ABA is much more specific for children with autism. In fact, it's more intense than parent training. To get ABA in the state of Georgia, usually you have to have a diagnosis of autism. So when a parent comes in and is looking for behavior therapy, they could be talking about any one of these therapies that they need for their children. So let's start with parent behavior management training. This therapy focuses on really teaching parents strategies to manage challenging behaviors at home. Parents have the greatest influence on their young child's behavior. This therapy is focused on training parents as to how to deal with their children's behavior. It's definitely recommended for kids with ADHD, with oppositional defiant disorders, and remembering that children just are not mature enough. Their brains have not developed enough to make these decisions on their own, or to learn how to do this on their own. So they need parenting help. So that's the way we deal with their behaviors, with the help of the parents. It's also based on positive reinforcement, consistent consequences, clear expectations, and we use it mostly for the young child. So what can parents expect in this kind of parent behavior therapy? First of all, this is not that we're going to fix the child. Again, a lot of parents are under the assumption that somehow there's some type of therapy that's going to change the child. And especially with the young children, again, their brains are not developed enough to even understand this. So we rely on parents to reinforce the positive behaviors and help them with the negative behaviors. So this behavior therapy is usually done in sessions, usually weekly sessions, about 8 to 16 sessions with a therapist, and the parents or families learn strategies to deal with a child's behavior. Sometimes they're done in a class of families. There could be multiple families. Sometimes it could be done online. But the goal is to work with the family in helping deal with the child's behaviors. And then in between, the family has homework to do. They go home and they practice these skills with their child. They see how it works, what's working, what's not working. And then the following week, they talk again about it with the therapist to see if they need to change the plan. This has been research-based. We know that it works. Parents who have gone through this are usually very happy. And after therapy ends, families continue to experience improved behavior and reduced stress. So who benefits from parent behavior management training? Kids with, first of all, you don't even need to have a diagnosis to start with this, but specific ones that are, it's definitely very helpful. ADHD, kids with impulsive behaviors. Again, their brain is not fully formed. They're impulsive. They may be having disruptive behaviors, hitting, throwing things. These are the kids maybe using bad language, oppositional behaviors, defiant. They're not following through. They're not listening. Emotional regulation, they're having extreme temper tantrums, and they can't handle their emotions. They may throw themselves down on the ground. They can be aggressive. They may be kids that are getting in trouble on the playground or in school because of their aggressive type of behaviors, which can also be very disruptive in the classroom. There are specific models that people use. These are kind of curriculums for parent management training. There's something called the Incredible Years, and that is something that if you can't get to a class, you can actually even just read the book about Incredible Years, which teaches positive parenting. Another one that's like that is something called Triple P, and they also have a curriculum which you can watch videos online. And then there's a specific one called Parent-Child Interaction Therapy, or PCIT, which is very helpful, especially for that young child. With parent-child interaction therapy, or PCIT, we're targeting the child who's young, so again, generally 2 to 7 years of age, who has those kind of disruptive behaviors. Again, they may be throwing things, they may be using poor language, they may be aggressive. And it teaches parents how to improve their child's behavior through structured play and coaching. And the idea on this, and it can be done in a center like ours, where the child and parent are in one room, the therapist is behind a one-way mirror, the therapist has a microphone, and the parent has a receiver, and the therapist is coaching the parent. It can also be done online. And what happens is the therapist is coaching the parent through the microphone. It starts off being very child-directed. We're teaching parents to build a positive relationship with their child, kind of mimicking what they're doing, commenting on what they're doing, providing a lot of praise. And then it becomes more parent-directed. So when at the end, the parent puts a demand on the child, such as having to clean up their toys, etc., and the therapist can then coach them through how to work with the problems that they may be having with those behaviors. So we're going to move on to applied behavior analysis, or ABA therapy. Again, I just want to show you, go over the distinction between parent training and parent management training, which is designed to really help with some of the behaviors that are almost even developmental, but more extreme. So again, those externalizing behaviors are those behaviors where, again, child is hitting, throwing, acting up, but kind of maybe developmental, but more extreme developmental, that is causing a problem, versus applied behavior analysis, which is really used much more specifically and more intensely, especially for children with autism. So here's Kelsey, and she's going to go over ABA therapy for you.
Hi, like Dr. Carnevale said, I'm Kelsey. I'm the lead behavior analyst over our ABA therapy program. So what is ABA? Applied behavior analysis is a science devoted to understanding and improving behaviors. So our main focus is those socially significant behaviors, and we use a scientific approach for discovering environmental variables that reliably influence socially significant behaviors, and for developing technology of behavior change that takes practical advantage of those discoveries. It's an evidence-based treatment. Some of the defining characteristics apply, so we want it to improve people's lives. Behavioral, the behavior in need of improvement is measurable and kind of whose behavior has changed. Analytical, so we're showing like a functional relationship is shown. Technological, detailed and clear, so it can be replicated by other people. Conceptually systematic, must be related back to the principles of behavior. Effective, is there actually improvement, and kind of generality, so over time, environments, people, and behaviors. So one of our goals is to identify the function of those behaviors, discover the environmental variables that influence behavior. We want to decrease dangerous behaviors and increase reinforcement opportunities, as well as demonstrate that functional relationship. So we typically look at the ABC model, which is the relationship between the environment, the behavior, and the consequence. So the central idea behind this model is the majority of behaviors are learned. The behavior is a result of certain conditions in the environment, not that people are purposely teaching maladaptive behaviors. So antecedent would be a person, place, or thing. That is the event that comes right before the behavior and is sometimes called a trigger. Behavior is any action that can be observed, counted, or timed. It's important that teachers, parents, and clinicians are clear and detailed about what behaviors are happening. Sometimes aggressive and disruptive are not specific enough. Consequence is the event that comes after the behavior. So the consequence is typically what is maintaining or making it likely to occur over time. So there are four main types of functions of behavior: attention, escape, and access to tangible, and then like a sensory function. We try to find that functional relationship between the antecedent behavior and consequence. Oftentimes, these maladaptive behaviors serve as a means of communication. So when a child can't verbally communicate what they want, they will often resort to other means to communicate their wants and needs. We typically use reinforcement, so change in the environment immediately following a behavior that increases the behavior in the future. So there's positive and negative reinforcement. Positive reinforcement is presented immediately after a behavior that causes behavior to happen more frequently in the future. And negative reinforcement is something that's removed immediately after a behavior that causes the behavior to happen more frequently in the future. So, and then there's also a non-contingent reinforcement, which is a procedure used where reinforcement is given after a specific amount of time, regardless of behavior. This is often used to decrease some maladaptive behaviors. There's also an extinction burst usually, which is no longer reinforcing a previously reinforced behavior. There's also punishment, changing the environment and immediately following a behavior that decreases the behavior in the future. There's positive punishment, which would be like a spanking after doing something. You're trying to decrease the behavior, and then the negative punishment is something's removed. That would be like removing the iPad to hopefully decrease talking back or something. But we always try to use reinforcement as an intervention first. Typically, the most common strategies used in ABA will be naturalistic, engaging, play-based, child-led, and we will sometimes use discrete trial training as well. I will pass off to Lee to finish up.
Thank you very much, Kelsey. So I'm going to talk about a few more behavioral therapies before we get into cognitive behavioral therapy, because really a lot of this falls under the B of the CBT. Systemic desensitization. Basically what will happen with this is we'll pair a situation which can cause an anxiety or arouse anxiety in an individual with a behavior that's going to lower that anxiety. So it's a type of conditioning that kind of occurs over time because we've put something relaxing with something that is stressful. And really this too falls under exposure therapy, because what we'll do with exposure therapies is expose something that may cause anxiety, expose the client to the anxiety so they can confront it, so they can adapt to that over time. Oftentimes we will create what we call a hierarchy of fears or we may start with the thing that causes the least amount of anxiety. Let's say you're scared of flying an airplane. Or we may just start with simply thinking about the airplane. And over time, we'll progress to things that are more just cause more and more fear over time and deal with those things individually. When you hear the term in vivo exposure, that's just simply directly exposing a client to an actual anxiety invoking event. Flooding, that is exposure to the anxiety that invoking stimulus for an extended period of time. And if you hear the term in vivo flooding, that's just a direct, intense, and prolonged exposure to actual anxiety. So as we go through here, you'll see kind of a variant of these things that happen in therapies that you might have experienced before, because a lot of CBT therapists, they tend to have just a toolbox of tools they'll use. And that also includes some of the things that we've already talked about. Now, in terms of flooding, if you're scared of snakes, we are not just going to throw you in a snake pit because we don't want you to come out of therapy with PTSD. So, you know, Pee-wee overcame his fear out of great bravery, but no worries when you go to your therapist that you're going to have to experience that on your first session. Another form of that exposure you'll hear about maybe is stress inoculation training. You know, that's basically where you'll introduce a client to a mild stressor, and they'll over time start to develop a tolerance for a stronger stimulus. And then there's just a process they go through with that. They'll expose the client will assess their anxiety levels, then they'll talk to the client or teach the client to notice those thoughts that are encouraging the anxiety. They'll then examine and reevaluate the thoughts, and then the client will note the level of anxiety after that reevaluation. So there's just this process over time of where they're just experiencing these stressors to hopefully help them adapt to other stressors. And so some examples of how I do behavioral therapy with some of those exposure techniques is if I have a client who may at Anna Shaw, I'll borrow some of those tools. And so if I have a client who may have selective mutism, they have a strong fear of just speaking in public, one of the things that I may do is, well, they start off with me where they often don't even want to talk to me. So I'll start with simply playing in the room, and they can come to me as they get acclimated to me and start to play with me. And then I'll ask them questions that are very simple, yes or no. And if they give me a nonverbal response of yes or no with their head shakes, then I'll provide positive reinforcement by giving them simple attention. And so see, that's another behavior technique that's used in ABA that's also pulled forward because that's a traditional learning technique of positive reinforcement. And then we'll go throughout an entire process to where they'll watch me through social learning, interacting with other people. That's the great thing about working at Anna Shaw is I get to go to other people's offices that the clients don't even know, and they just get to watch me interact with those other people. And over time, we'll then go back and start practicing things they can say to them. And we'll go to the other offices that they might be a little stressed about doing, and they'll get to have their own practice conversations that they practice with me. So there's a natural hierarchy of fears you see in that process that the client is going through, and their anxiety is being as they're being exposed to that anxiety. And so we're going to be really brief about CBT, mainly because we've talked a lot about interventions that involve the B. And so really a lot of modern behavioral theory, sometimes people will just put it in that bucket of CBT, even though it's strictly dealing with behavioral symptoms. But the C comes through that talk therapy part. And sometimes that's what people will oftentimes experience when they go to a therapist. And so cognitive behavior therapy is just this natural progression of behavior therapy. What people believe, and this is what people believe influence how they act and feel. And so we're dealing with that thought part. When I say think about cognitive, I think about, look at that word cog and think of the gears turning in your head. Your thoughts could influence what you're perceiving. And so cognitive therapy was created by someone named by a clinician named Aaron Beck. And so Aaron Beck's cognitive therapy aims to change maladaptive thought patterns and perceptions. And then you may hear somebody say they are an REBT therapist. They use REBT in cognitive behavioral therapy. And that was very similar to Aaron Beck's theory. They have a model, an ABC style model, but really they're focused on those rigid or extreme beliefs that contribute to psychological problems. So for example, they may say, I'll never be able to talk to another person again. And they'll think about those thoughts over and over again. And so we'll start to challenge those thoughts. And I bring up Aaron Beck theory specifically too, because that's a theory that may come up a lot if a client has depression. And most talk therapies tend to have the same outcomes and success rates when it comes to various symptoms. But cognitive therapy by Aaron Beck, specifically that model, oftentimes that's very high and very successful in treating depression. But also when it comes to these talk therapies, I may not use these talk therapies if a client strictly is having some behavioral situation. So OCD, for example, it's hard to talk somebody out of those compulsions. So behavior therapy can be very important in that. For my younger clients that struggle with articulating their thoughts or may not be as developed cognitively, I'll use a lot more behavioral techniques within my CBT model. And finally, really, CBT often requires exposure to some form of stress. And that was, if we go back to Aaron Beck, that was really part of his philosophy, is we have to expose people to things that are a stress through that talk therapy. And so even when we're with a talk therapist, you may have an experience of this long pause and silence. And a lot of times the therapist does not want to get in the way of you processing your thoughts, processing your feelings, because you are having to confront your own thoughts that may be stressful to, which may make it difficult to articulate. Finally, as far as resources go, these are several resources that for you to look into: understood.org, challengingbehavior.org, childmind.org, and there's also an Anna Shaw Children's Institute video library at the link below. Hope y'all have a great day and take care.